Hey everyone, welcome to Truth Be Told, a podcast for women and those who listen. It's a platform that brings voice to the silent and creates opportunities that are impactful. I am your host, Michelle Lorraine. Thank you for coming and joining me on Facebook Live. I want to give a shout out to my daughters, Cheyenne James, for my social media work, and my producer and tech support, Jalen Rachel Richards. So I just want to thank them. They're always here helping me out. Today we are on season number 2, episode number 5, and the topic is mental health and the church. This is definitely a conversation that is well needed and has been needed for some time. So please feel free to post and ask questions, make comments, and even submit thoughts or other topics that you'd like to have addressed as well, and you can send that to me directly. I am greatly honored to have two knowledgeable people on this subject. We have with us this evening Pastor Dr. Zackari and Dr. Elaine Brown Spencer. Please help me welcome them to Truth Be Told. Hi, Pastor Zackari and Dr. Spencer. How are you doing today? Good. Excellent.
Thank you.
Good. I'm so glad to have you on the show. It is an honor. Thank you. Thank you so much. I appreciate you taking time out to especially speak on this topic, which has been very important and something I think is very needed, whether it's in the church or even within the community. I know we have a lot to cover, so I won't take too long to get into it. But before we start, just to give our audience a little bit of knowledge of who you are, I'm going to start with you, Pastor Zackari. If you can just tell our audience a short note of who you are and what it is that you do.
Well, I'm a pastor in Brampton area, Chicken Tabernacle. But my professional background, I did my BA in social science from York University. I did my master's in theology in clinical counseling from Wycliffe College, U of T. And I did my postgraduate studies in family-oriented psychology at Guelph University, and I did my doctorate in family-oriented psychology. I am a registered psychotherapist, I'm a registered marriage and family therapist, and I'm a clinical fellow with American Association for Marriage and Family Therapy. That's my background.
Awesome. A lot of information there. You have a lot of knowledge, and we thank you for joining us. And Dr. Spencer, tell us a bit about yourself as well.
I'm also a York alumni. I did my undergraduate work at York University. I did my graduate studies. I did my MSW at U of T. I did my doctorate, my PhD at the University of Toronto. And last year, the year before, I launched Mental Health as the Church's Business, because I'm also a very strong advocate of merging faith in terms of how we're addressing issues of mental health for believers. And I also teach social workers at York University as well. So again, invested in the practice of helping persons sort through health and challenges from a social work perspective, and also from a faith-based perspective as well outside of York.
Wow, excellent. And you just married the two together, which is amazing. And we are so grateful for both of you, and we're looking forward to this conversation. So let's get right into it, because I know we have a lot to cover. And we're going to start off with you, Dr. Spencer. In your opinion, is mental health illness a disease that the church is afraid to deal with? Do you feel that it is something that the church is afraid to deal with?
I mean, it's a yes and a no, because I'm in the church and I'm not afraid, but others may be in the church and may be afraid, right? But I mean, in terms of the institution, I think that fear often just comes from lack of knowledge, if you don't understand what you're dealing with. And I think that the church has always been dealing with issues of mental health, but from a particular perspective that may not have a balanced approach to looking at the body, the soul, the spirit. I think we've been very good at dealing with the spiritual aspects of mental health, which there are, but maybe not really understanding the other implications of that, where there's chronic situations that need different types of interventions. And so I think the fear also comes in abandoning the spiritual, as if to, like, I think sometimes the feeling is that we're going to do away with the spiritual approach. So the fear of, introducing any other types of intervention sometimes can be looked upon as, that's not for us kind of thing. So I think it's just about knowledge and education. And I think more and more people are realizing how important it is. So I think the fear is dissipating, and I think it's just more about just not understanding and what to do. And so, I mean, obviously that's why we're here today, right?
Right, exactly, exactly. And Pastor Zackari, did you want to add anything to that?
Exactly, what she said is true. But I will go a little bit further about the church. Most certain particular denominations, sometimes, they don't acknowledge mental health. Now, since times have changed, people become more enlightened, as Dr. Spencer was saying, true. But it's exactly true. Sometimes psychiatric disorder and spiritual issue overlap. And if you're not skilled, possibly the church will lean towards spiritual aspect of the presentation because of lack of knowledge and understanding of how this sometimes interplay.
Right.
Or interconnected sometimes.
Right. Okay. So then I'll ask you this question, Pastor Zackari. Has church culture then affect the way we deal with mental health?
Yes, true. When you use the church, sometimes when you use the word church, I can have difficulty to embrace the church because I received about 40 years ago, a lot of denomination actually, almost 50 years, embrace mental health. Only certain, like mostly black churches, Pentecostal denomination, that they minimize, they normally downplay mental health. And so they don't embrace it. But I think now people know that it's illness like any other illness, because in order for me to see properly, I wear glasses, right?
Right.
Because if I don't have any, now you need to open up to embrace mental health as part of illness that need to be addressed, resolved, because mental health issue is also a spiritual issue.
Okay. So you feel that mental health issue is a spiritual issue. Can you elaborate on that just a little bit more? How is it a spiritual issue? Is it just like any other disease? Is cancer a spiritual issue? Can you elaborate on that a little bit more?
Okay. So in the field of psychiatry, when you use the word disorder, it's the opposite of disorder is well-being. And disorder is anything that undermines chronically or frequently undermine your functioning.
Right.
And when it comes to spirituality, it's a behavior driven. Look up at the fruit of the spirit. It's all behavior based. So i.e., if I'm dealing with somebody who have maybe attachment or severe depression, this person may not function well spiritually. If they get angry, engage in destructive behavior, people who struggle with attachment issue, undermine their function. I read a book that emotional maturity affects spiritual maturity, and there's a research support that claim.
Okay.
So if you are very impulsive, very reactive, these are the antithesis of spiritual functioning.
Right.
Because the Bible says you have to be exercise self-control, temperance. And here I'm aggressive and reactive because of my mental health issue.
Right. So then, with that being said, would you say then if somebody enters a church, and they are triggered and they're reacting a certain way, is that something that can be cast out? Is it something that is rebuked? Is it something that is dealt with in a spiritual aspect? Or do we need to take other measures, like taking that person one side and speaking to them?
That's a very good question. I think the church, in that kind of setting, the spiritual setting, but we don't know people's psychological profile.
Right.
They come to church, they worship, but we don't know this person's background. So a lot of church these days, in their discipleship, they do what is called genogram to explore your spiritual background, your background, where you're born, your experiences, so that they can have a firm understanding of who you are. So you have to start from a place of love. and try to explore further, because we see the person in church, but we don't know their profile.
Right. So, Dr. Spencer, then I'll ask you this question then. Can the way we communicate in the church cause triggers to have people respond the way that they do within the church, especially those who do have mental illness or a mental health instability?
Yeah, I mean, anyone can be triggered anywhere, and it depends on what we're saying. What are we communicating? Is the person who's saying it directly related or impact one's mental health, right? Because we know the church is a community, and oftentimes things even in those communities happen that impact people's mental health. So yeah, triggers can happen in the church, and I think it's just a matter of the languages that we use. For example, especially Afro-Caribbeans, and I know other cultures have certain labels that we put on people who we say have mental health, right?
Right.
Them mad for Jamaicans, right? Or things that we would say. And I mean, for anyone struggling with that, it may not be a trigger in terms of the episodic, but it could be how they feeling about divulging what they're going through.
Right.
Or the challenges, if you hear your environment talking about you or these things in a very negative way. So I think, again, about education, how do we refer to individuals? How do we refer to what people are experiencing? What does mental health look like? What are the types? So I think that it's almost like a one-on-one, especially officers of churches need to be educated on this, because there are many people come through our doors that are part of the community of the church and visitors, right? And just to touch on this, the rebuke, I just want to say that as people of God, we never want to not think that the Lord does not have a role in our interventions. But I think that we have images of what rebuke looks like. Because we have to know there is an adversary who is after us, who's after our mental health, who's after our physical health, right? Is after our spiritual health. So we always have to kind of keep that in perspective. But I do think that, a lot of Pentecostals have an image of when you hear the word rebuke, but it could be someone's getting help, but we are still praying through to, you know what I mean? Like backing it up or what have you. And again, it depends on what we're dealing with. And I know that's probably a question that's going to come up later, but triggers are everywhere, and absolutely we can do things. And so we have to really be careful how we talk one to another. And as Pastor mentioned, should always be undergirded in the spirit of love.
Right.
Love.
And it is actually one of the questions I wanted to ask. You kind of touched on it a little bit early, but that's okay. I was going to ask then, do you feel, either one of you, do you feel that it should be a prerequisite to being a pastor or a ministry leader that you should have some kind of teaching or education along the line of counseling or some kind of psychology where you can understand, as you mentioned, knowledge is power. And the Bible says, my people perish because of a lack of knowledge. And so we want to make sure that we are knowledgeable, not just spiritual. So do you think that is something that is important, that pastors and leaders should have that course taken or a course taken to help equip them for this type of ministry?
Absolutely. I'm not trying to bash and put down our oneness Pentecostal background, but mainline churches, if you go to a school like McGill or any of the big name university for seminary, theological faculty, if you're going to do masters in divinity, you have to do counseling. It's a core part of the program, because you have to remember, counseling comes from spirituality.
Right.
In ancient times, when people are ill or have any struggle, the first place they go to consult the spiritual leaders. So pastors need to have some form of understanding. I have a book here, actually. It's the Minister's Guide to Psychological Disorders and Treatment. Every pastor needs to have that kind of understanding. You won't be a clinician, but you need to have an understanding that people come to the church, they have their own struggle, like the doctor said. Very true. People come, we don't know their background, and the way you relate to them, you have to be very mindful. So pastors need to have that. We need discernment, but we need to also have some certain counseling skills to relate to people.
Right.
Because a lot of people come to get you are broken, you are wounded, and by and large, we are all wounded some form. Every human being have a deficit. You may not have mental illness, but every human being struggle with mental health because sometimes we struggle with we experience psychological disequilibrium when we all do, when you lose something or something. So you can all get triggered, even though we don't have mental illness. Mental health is an issue that all humanity struggle with.
Right. Okay, thank you for that. Thank you both for responding to that. So one of the questions that I had here was, does the church feel that mental illness is a punishment from God? That's a hard one. So, Dr. Spencer.
If mental health illness is a punishment?
Yes.
No, absolutely not. I mean, sorry, are you asking it from, I don't see how.
So basically, the question that was proposed was, does the church feel that mental illness is a punishment from God? In other words, people who end up having mental illness, and because they spiritualize it, do they feel that it is something that is a punishment from God?
I mean, anyone that agrees with that would have to then say all sicknesses are punishments.
Mm-hmm.
Good one. Good answer.
Right.
So that's equivocal. I mean, that doesn't need much breath into that in terms of us breathing on that question, because you have to know, if you believe that, then everything that happens, you think that it's judgment in terms of what we.
That's right.
And so adding to that, I would say that in the past, mental health issue has been deemed as demonic. That's what happened.
That's right.
And anything demonic seemed to be perceived as almost like a curse, or you are ungodly, and sometimes the devil is controlling you. And that's what happened. And this has a long history in the church. How kids with ADHD have been beating them up and say they're casting the demon. But this child has ADHD. People have a very severe depression that sometimes it triggers psychosis, organic psychosis, and perceive that they have demons. Right. So that's very tricky. And again, how the Pastor said previously, that lack of knowledge. But now we begin to know that mental health is illness like diabetes or any illness you can name of. But in the past, exactly, they look like it come across to people, many church denominations, that is a curse because it's demonic.
Yes, and that's exactly, I think, the point that they were trying to make, is that when people are displaying an issue, as you mentioned, the ADD, they try to pray it away or cast it out as though it is a spiritual demon of some sort. So thank you for answering that. Now, would you agree, or your thoughts on, if there's a disconnect between the church leaders and their members in the sense of communicating how to work through this process of dealing with mental health issues or just mental illness as well? How do you think that they should communicate or be able to implement some change or direction as to what to be done? What would you recommend in your knowledge or in your professional aspect?
I would recommend structured open dialogues. I know a lot of churches have some form of auxiliary departments, or the way they organize themselves, and I think that you could organize mental health topics, discussions along auxiliaries, if you want to look at youth, if you want to look at the age, because I find that churches often have these type of structures where we kind of organize by groups, whether it's by gender or age or what have you, and begin the dialogue and just open it up, and just even mental health 101. And I know in New York City, when I went there and I did a symposium there, I was shocked to know that the city governments have, just like how we have first aid courses,
Right.
they have mental health courses for frontline workers in churches or institutions where they deal with the public, and people can go through a 2-day course and just learn about, not to be a clinician, but what to be aware of, or if certain things happen, what are the resources in your local city, what should you do if this happens, what do you do if and just educate along that, and get people talking about it. And I think the more we talk about it, it's more we now sensitize ourselves to the issues that are around us. But in doing that, it also has to be done, in my perspective, with a lot of grace and spiritual understanding. I do not believe that all mental health is clinical. I do believe there are cases where people have been possessed with a demon. It's not even a popular thing to say anymore. And I said to myself, I want to be careful also in my work that I'm not portraying this thing that the devil has no play, and how he's worked through traumatic thing in terms of doors that have opened in people's lives, and a stronghold comes in there. Because the Bible tells us about what strongholds are, right? So we have to differentiate what we're dealing with, and really through discernment and clinical understanding, what is it that you're dealing with? Because I've seen it face to face where it's not clinical, there's a stronghold there, and for those who had that gifting were able to deal with spiritual issues, right? So we have to have a balanced perspective, and not do what the church did, where it's all spiritual and never looked at the clinical side. But we also have to be careful where we also don't go to the extreme and just deal with it clinical and not address the spiritual. We have to bring it together. And I think that's the key point for my work, where I've been saying that's the perfect marriage in terms of using spiritual understanding, right, with the human condition, and understanding both realms.
Right.
So you're working through it with grace, through the power and the anointing of God, who's giving you the wisdom on top of that knowledge that you may have gotten through studies and what have you. And now you're able to intervene, because a lot of people from faith-based communities will not seek help because they rather have someone from the faith-based community deal with their situation. But if we're not skilled and equipped, where are these people getting help? What happens? It often gets worse and more chronic. And then it leads to, where now they're having to take medication or what have you. But if these sometimes situations are caught early in love and wisdom, right, with that balanced understanding, I think we can help a lot more people. So I think that's, for me, I just wanted to kind of put that out there so that we're never ever thinking that there's not an adversary working against and who has had major, because you see, when trauma happens in people's lives, often we don't understand how the enemy can really play on someone's mind and situations, and why I say that is because when I heard how the use of cannabis is now becoming a biological issue that can be passed on. What do I mean by that? I was listening to a psychiatrist who was talking about U of T. I was at a conference where there's kids that have developed psychosis as a result of use of marijuana and cannabis. And what they found in research, they got psychosis, which turned into schizophrenia. And then as parents, if they have children, they're now able to pass that on to their children. That did not start as a biological. Now, some people may argue that they may have been predisposed, maybe they carried a gene, but how could that have gotten to a mutatable state where now that's passed on, right? So there's so much complexities to all of this. So we never ever as Christians want to say it's all on the clinical. We have to have a strong knowledge, but also you got to pray it through. You got to understand that the enemy is there, because I believe that it's with the mind that we serve the Lord. And so he's going to come after the mind in whatever shape or form in conditions and situations that we go through in life.
Right. Perfect. We do have a... Sorry, go ahead, Pastor Zackari.
I want to clarify that because I'm a pastor as well. I'm a pastor and a clinician, so I have word about heart. One, any psychological issue need to be treated with spirituality, because everything that presents in a physical form has some form of spiritual source. So you have to look about that. also you have to be balanced. As I agree with everything that she said, because we can be all or nothing. We have to use discernment. Even if it's anxiety, we can also sincerely say that there's a spirit of anxiety.
That's right.
So about anxiety disorder, we can also construct a narrative around that presentation, that a spirit of anxiety. So one of my professors told me that psychology will be the problem and spirituality heals. Because psychiatrists and psychologists and clinicians, we treat, but God that heals.
That's right. That's right. Good. We do have a comment from Facebook.
Yes, there was a question, and the question says, is it necessary as a Christian to see Christian therapists? If yes, how do you deal with fear of judgment?
Want me to go ahead or want me to say that? Talk about that? Yes. It's absolutely good. It's absolutely necessary to talk to a Christian. That's why we need church have a most counselors in the church setting because of the value system. The world have different standard, and they will use well standard to support you. I have worked with people that they feel lonely, and they will encourage you to go certain social places that possibly it go against your spiritual values. So the thing that they will enforce or they impose on you is not healthy. So ideally, it's good to talk to a Christian counselor if necessary.
Okay. Thank you for that. And then I'll just throw this question out to Facebook, and if anybody wants to answer this question is, what if you do have a fear of going to the church for counseling, why do you have that fear? Okay, that's the question I'm sending out to the Facebook listeners. Now, there's another question here. Does having mental health in this, dealing with the mental health issue like low self-esteem and depression, make you less worthy to participate in ministry or in relationships? So if you have a mental health issue or illness, does that prevent you from working in ministry or being in relationships? And I'll ask Pastor Zackari that question.
It's put upon your diagnosis does not define you. People have different level of resiliency. I had a good preacher, one of the good preachers, many years ago called Charles Spurgeon. Charles Spurgeon had deep depression. If you able to read about his diary. So people have mental health. A lot of pastors, a lot of ministers have mental health. As a clinician, I've met many doing workshop in the States, in seminar. They come and talk to me one-on-one. You can do ministry. Here is upon the level of your functioning. Sometimes, if your illness seems to control your day-to-day function, possibly it will affect your effectiveness. But you can have mental illness and do ministry because it's very common. God calls you and God is capable able to keep you with all your illness. God able to do. Because none of us actually, let me tell you the truth, that none of us in the church, everybody in the church have some form of deficit. Including pastor, the one who baptized yesterday. Let's make it very clear.
Yeah. I agree.
Dr. Spencer, did you want to add anything to that?
No, I agree. I'm just yes.
Yeah. Because even as a doctor will need to go to a doctor to be taken care of, as a dentist will need to go to a dentist to be taken care of, then so does a pastor or leader need counseling. And I think that is very important for them to understand that. Would you agree with that statement?
Yes, when I do my PhD, I have to go to counseling for 56 hours.
Right.
Because what happened is, we are not perfect. We are called to be wounded healers. But if my deficit, I don't know myself, I will even... A lot of pastors destroy people's life. I've been in church for a while, over 30 years, and I know some pastors, if you don't resolve your own issue, you're going to abuse people, you're going to affect people's life negatively.
Right.
I don't know if Dr. Spencer can take on that, but yes, you have to.
It's extremely important,
Yes.
that aspect. Michelle, as you know, for 10 years I was dealing with private pain in public pews, book and all the work. And this is what you see is that the brokenness and not wanting to address their issues, and then just, as Pastor said, destroying people's lives, right? And you have to know, and I mean, even those in the field, like you're supposed to have people in your life. If you're dealing counseling, you're supposed to have people that you can bring cases to. I mean, a lot of clinical, it's set up that way, right? You have to be able to upload, you have to be able to talk to others, right? I'm writing a book right now, and I find I'm constantly talking and flushing it out because there's some ugly things I'm uncovering, right? I'm not circling that in my head. I'm talking that through with some, you know what I'm saying?
Right, yeah.
And I think especially these leaders, and we're starting to see that, where we're seeing leaders who've come out and people are starting to, take their own lives and the pressure of ministry. And I think ministries have changed because I think they're seeing so many different dynamics in the congregation. And who do people go to? Do you know that people go to their pastors even before they go to their doctor?
It's true. It's true.
Their pastors everything, right?
Yeah.
And
That's
they're hearing this, and they may go into their own challenges. So it's so important, I think. But I think it's because we've created this kind of image of perfection, like, it's almost like they're God, right? Like there's no there's like they're infallible, like they're supernatural, you know what I mean?
Yeah.
But yet they're people.
They're still
we
people.
We realize that,
Exactly.
and we have to kind of change that so that they feel even comfortable coming forward to someone who they trust and who can support and help them through tough times. Because think about COVID. Imagine what a lot of pastors are dealing with. Churches have been locked down, right? And there's these needs of the saints, and they're coming forward, and they themselves don't know what tomorrow's going to look like. Are the saints coming back? Or people are shut in, and people are feeling lonely, and they're calling now, I need help. Churches, oh man, I've been thinking about for the last 4 months. We think about each other, but think about our leaders, right? And having to manage and continue all this. So,
and I believe it's very important for us to understand that pastors cannot carry the whole weight of the whole church.
Right.
They can't, right? Even Moses, they had to hold his hand up, right? We cannot, Aaron, thank you. We cannot expect that the pastor is going to be able to carry the emotional health of every person in the church. And this is then my next point or next question is, what are we doing in the church to make sure that pastors are not burnt out and that the people are ministered to, in the sense of making sure that you have counselors on hand and that when it is necessary to direct people to the counselors? Right? And I think that is something that is lacking in our church. And I'm going to ask you, what do you think we can do for the church to make it more supportive for pastors and to ensure that members that are struggling with mental health issues or mental illness, that they will have a resource within the church? What do you recommend?
Well, I think that churches who may not have counselors in the church needs to connect with those resources that are in society, and having links or networks, because there's a lot of Christian psychotherapists out of their lots, right? But do we know about them? Is there a list provided? Do they come to our churches? Do we allow them to come and present for their agency dues, or if they're in private practice? And I think, and then we should be encouraging people to go. And I also believe, though, that churches also have to set up a structure for persons that can go and pay for the services. Because a lot of times, people want counseling, and as soon as it comes to them parting with their funds and their money, all of a sudden no one has any money to, right? It's ridiculous sometimes when you think of it. So I think either churches have to have supportive ministries to help people with funding, or we set it up and let people know, like, a lot of the resources are there, but it's not for free, and you do have to invest in your health.
Right.
Invest in your health. If you go to the gym, you pay a monthly fee. If you're going to go see a counselor, don't think they're going to go out there and you're going to go to counselor out there and with your long hand. Like you have to know.
Right. Yep,
I-
exactly.
and it's
Well
not-
said. Well said.
Yeah.
Well said.
Mm-hmm.
Well
We
said.
have to change
Absolutely well
that.
said.
We have to change, because a lot of times people are talking about this, but they just think someone's going to sit with them for 10 sessions and not be compensated. If you talk to any counselor out there, like that's their livelihood. And
Yeah.
I think there's this thing in the church, right? So we got to kind of change that as well.
Right.
And let people know, just like you go to the dentist or what have you. And then also we can lobby our drug plans and insurance companies to ensure that we get these attached to people's benefits so
Yes.
that people can even access these things.
Yes.
So there's a lot of advocacy on different angles, right? That I think that we need to be doing.
And we
can
need to
even
let them
start
know.
at what are the resources presented to the church so people know where to go.
Yes.
Sometimes people will not go to their local assemblies because, our churches are so connected. Everyone knows everyone.
Yes.
Well, sometimes people just feel cute. You know what I mean? Oh, I don't want to go to Sister Jane because I have to worship with her next Sunday.
Right.
But they may go to Sister Kathy to the church downtown.
Yeah.
That's
That
right.
they don't know Sister Kathy, right? So it's a matter of,
And
plugging in.
and that's okay. And that's okay.
Absolutely.
Yeah.
Yeah, it's true because therapy can make you vulnerable. I've been practicing this over 16 years, and I know her as Sister Layton for a long time, so I'm tempted to do that. What she said is absolutely critical. That we should. I'm a pastor. Sometimes I don't see people in my. I don't want to provide an assessment. I want to see somebody outside the church. I'm scared that when I'm preaching, they may think I'm preaching about them. I draw that kind of boundary. So it's good to know. I want to even know some therapists in the community. They're Christians, so that kind of help us. As a Christian therapist, people from as far about 150 kilometers away come and look for me because they want to talk to a Christian. So we need to do. I see a lot of churches refer to me, but they need to do people within, and a lot of programs need to be developed in the church as well. Trauma-based, attachment issue, those kind of things. We need to run a lot of program in the church to support that
Yes.
area.
That's true. That is true. Do you have anything else, Pastor Zackari, that you would like to share that people need to understand about whether it's mental health or mental illness or the importance of counseling?
Counseling is so critical. You need. I like what Dr. Spencer said. God is the center of everything, but we need to know who we are because when it's a disorder, it means it's impairment. It affects your functioning, and anything affects your functioning can affect your relationship and your spiritual maturity. Area that I will focus on about mental illness and mental health issue will undermine your spiritual growth. Period.
Thank you. Thank you. And Dr. Spencer, what would you add as it pertains to finding resources and ensuring that what we've gone through is not the end of all, but there is a future ahead of us?
Absolutely. Our future is brighter than our past, and we should always have that God, He's committed to our well-being, right? He said He wills for us to prosper and be in good health.
That's right.
That's right.
That's
what
right.
it says, right? What we said, and encourage those. This is not the end. Like, you can get through it, and the more we talk about it, is more people that are in silence, that are experienced what their experience are going to know. I can make it, and so we have to keep driving that. And many resources, people are starting to talk about it, and also how they've overcome. And so even I put together a docu-film that's going to be coming out, releasing it shortly, and that's what we did. We went around and we interviewed, and there was cases in there of individuals who've overcome. And they talk about their experiences, and it's so encouraging. But then it's also that you see the church reflected, like, wow,
Yeah.
something as simple as someone coming to church late. You don't even know why they were late. You don't know how hard it was.
For them to get there.
Right.
Yeah,
And it could be chronic mental health issues, and they're just trying their best. And then here you are, say, sister, why are you so late? You know what I mean?
Yeah.
And we can crush people like that. But like I said in that docu-film, people can connect to that even.
Yeah.
To say, wow, she went through that, he went that, I can make it through.
Right.
And you know, pastor and a clinician, we don't see that in Pentecost. I'm sorry. We don't see those two variables, like, you know, with Pastor Zackari in terms of pastor and clinician. Like, we need to parading that. You know what I'm saying? Because I think sometimes we often just go to the same people who we know about, but there's a lot of people doing the work and a lot of people that have overcome. And because God has invested in us and because he lives in us, he moves in us, he breathes in us, he's going to take us through. We are overcomers. We are more than a conqueror. And even if those who are hearing us even now or in the future, and you're dealing with this and nobody knows, God cares. And he loves you.
I think it's very important for people to testify, because I know that I've been in testimony services and I've heard, you know, Rock of Ages, cleft from me. They're not testifying. They're just repeating a song. But I think when we hear true testimonies of victory, I had this, I went through this. This is the power of testimony. It gives people the encouragement and the strength that whatever it is that they're going through, because you're saying, Dr. Spencer, that people are victorious. But if we're not hearing the victories, we're thinking we're the only one going through the struggle. We think we're the only one going through the struggle, but this is why they say our testimony makes us stronger. When we share what we're going through, then others will see and be led to glorify God. They will be encouraged and empowered that no matter what it is, God will see them through. Right? So I just want to thank you both very much for being on our program, Truth Be Told. I really appreciate that you took time out, and I do hope that those who are listening has received something that encourages them or provides them knowledge. And if there's anyone that is out there as leaders, I pray that just basically what Pastor Zackari and Dr. Spencer has said about having resources. If you don't have those resources, please try to connect with either one of these individuals and see how they can provide you with information. Also, last week we had Cheryl Nimhard on, and she provided a very great resource of information as well for mental health. And I know that we'll be able to provide information just to help people along the way. Next week, Tuesday, at the same time, we will be doing part 2. And this will be Youth Speak Up on Mental Health and the Church. We will have Minister Craig Irish, Brother Daniel Harper, and Sister Dana Dwyer that will be on the program. And again, send your questions, comments, and ideas that you'd like to share. And today's quote is, "Truth be told, your choice of words can cut or heal. Choose your words wisely." And that by yours truly, Michelle Lorraine. Have a good evening, and thank you all for joining us, and be blessed.
Thank you too.
Thank you. Thank you.
Thank you. God bless.
God bless.